Good day, everyone. I hope all of you are doing well. My name is Jared Brown, and I am the presenter for today's webinar presentation that is titled Adverse Childhood Experiences, Complex Trauma, and Criminality, a Neurocriminological and Forensic Psychological Perspective. If you have any questions about any of the content that has been covered in today's webinar presentation, please don't hesitate to reach out to me and send me an email at the email address listed on this slide. If you are looking for additional resources, links, or guides, or just have general feedback, please don't hesitate. I always get back to individuals. Here's a copy of my brief professional biography. I am a professor, trainer, researcher, and consultant. I have a number of different degrees in related fields and topics. I do a lot of publishing, appear on quite a few podcasts, talking about a number of the different topics that we're going to be covering during today's presentation. Here's a copy of today's training description. We're going to take a deep dive into really all things trauma and how it intersects with the criminal justice, the legal, the forensic mental health systems, and we'll weave in neurocriminology research and its implications too for the forensic psychological fields. Here are the training objectives for today's webinar presentation. You're going to walk away hopefully knowing a lot more about the adverse childhood experiences research, complex and developmental trauma. We'll talk about toxic stress today, why it's imperative to understand these topics if you're working with individuals who engage in problematic, aggressive, violent behavior, criminality. We'll talk about different kinds of screening, intervention, interviewing techniques throughout today's training, and really everything that I talk about today is rooted in the empirical-based research literature. On the bottom of most of my slides throughout today's webinar presentation, you will find the full citation. So before we get into the weeds with trauma, there's a good handful of topics I would like to talk about and introduce all of you to, because I think it's imperative if we look at this topic through a lens of criminality to have an understanding of some of these topics. And the first area is neurocriminology. When you study neurocriminology, obviously it encompasses criminology research, but it takes it a step further where you're encompassing elements of neuroscience literature, biology, behavioral genetics, physiology, neuroimaging research. We're going to talk about prenatal factors as well as postnatal factors. I would also direct all of you to the field of biosocial criminology. I think that's helpful to understand. At the core of neurocriminology research is really understanding criminal behavior at its neurobiological roots. We're going to talk about that today. Neurocriminology research is also concerned about the various forms of brain dysfunction. If you're working in the criminal justice arena or mental health fields and you're working with clinical or forensic populations, there's a pretty good chance that an elevated number of the clients you work with are dealing with some level of brain dysfunction. Brain dysfunction can come in many shapes, sizes, and forms. The causes for that are many and varied. Trauma can contribute to brain dysfunction. Strokes can contribute to brain dysfunction. Neurocognitive disorders, if you work with individuals with psychotic or mood disorders, personality disorders, substance use, people exposed to long-term toxic stress, people who lived in prolonged situations of poverty, homelessness, people that are exposed to drugs and alcohol in utero, individuals that are experiencing nutritional deficiencies, food insecurity, malnutrition. We'll talk about all these topics today and why it's important to really look at this through a neurocriminology lens, in my opinion. Going a little bit deeper into neurocriminology research, be aware there's a lot of things going on with this field of study. Some topics you want to be aware of. I'm a big fan of understanding prenatal trauma. I think it's imperative. If we want to understand criminality, a lot of the research says study early childhood. Very important, but I think we need to look at the in utero world too. I really think some of these things can begin in utero. When you study neurocriminology, it talks about prenatal alcohol exposure, prenatal nicotine exposure. There's several studies that look at the harmful effects of prenatal exposure to nicotine, lead exposure, birth complications, nutritional deficiencies, as I mentioned in the last slide, being aware of our autonomic nervous system, our central nervous system, the HPA axis, our hormones, neurotransmitters, being aware of heart rate variability, skin conductive testing, even omega-3 fatty acid deficiency and supplementation. What about genetic influences? These are all things talked about in the neurocriminology literature. But it's also very, very important, as we know, when we study this field, to be aware of the social factors. Family dysfunction is a huge variable to consider when we study antisocial behavior. Family dysfunction could be the result of growing up in a home where that child is witnessing tons and tons of violence. We need to be aware too of any other social factors, community violence exposure, peer rejection, socioeconomic status. These are all things that we're going to cover today. So if you are a clinician, practitioner, whatever job you do, if you can understand neurocriminology research, I truly believe you will be in a much better position to understand human behavior, human dysfunction, criminal behavior, irrational behavior, unreasonable behavior. The list goes on and on and on. These are some of the neurobiopsychosocial abnormalities you'd want to be aware of when you start to learn about neurocriminology research. So biochemical abnormalities can happen from a variety of situations. Trauma can throw this off, sleep deprivation, the way we eat, gut health dysfunction. In this literature too, it talks about high testosterone levels. There's actually fascinating research that looks at this as well. Psychophysiology, this is really focused on the underpinnings of like heart rate variability, skin conductive testing, things of that nature. Being aware of head injuries, head trauma. We know from the research, if you study criminality, unfortunately, a very high percentage of people in prison have histories of head trauma. This research really looks at premature birth. That could be a factor in some of these cases, or birth complications. Being aware too of exposure to alcohol, drugs, tobacco products. There's some literature that talks about food or chemical sensitivities. And then also being aware of these environmental contaminants. This could be a good example of this would be maybe pollution exposure. There's actually a lot of research that has looked at pollution exposure in relation to crime. Lead exposure, mercury exposure, endocrine disruptors. These are all things that can have a very negative impact on our brain and body. I really enjoy this field of study, neurocounseling. I think this is very helpful when you are developing a goal plan, intervention plan. Understanding neurocounseling literature can also help you develop interventions that might be more appropriate for someone that is dealing with a lot of brain dysfunction. So if you're not familiar with neurocounseling literature, this is basically the integration of neuroscience into counseling practice. But if you're not a counselor, that's okay too. This research, I think, is just as important for a probation officer to learn about, or a police officer. If you can become neuroscience informed, you're going to be in a much better position just to understand human behavior, human thinking, human decision making, and so on. People that study neurocounseling typically are going to have more training and awareness in the central nervous system. They're going to understand the interconnectedness between our brain, our body, our mood, and our behaviors. This field of study basically is an integrative mind-body approach because our thinking impacts our body and vice versa. This field of study also takes into account biological factors, psychological factors, social factors, physiological factors, and some of the interventions that are talked about in this field of study relate to brain-based psychoeducation, which is basically providing education to clients or their caregivers about whatever topic or situation they're dealing with. Just the very nature of providing education can help improve outcomes. This is really focused too on biofeedback, neurofeedback, neuroscience-informed cognitive behavioral therapy. This research also talks about neuroplasticity, mindfulness, meditation, therapeutic lifestyle changes, which has a lot to do with like weight management, diet, getting good sleep, and the list goes on. So neurocounseling, another very, very important field of study to be aware of. Another field of study that I find extremely helpful in understanding is a field called psychoneuroimmunology. Sometimes it's referred to as psychoneuroendocrine immunology. This field of study, in my opinion, can really help us better understand human disease, human disorder, human illness. This is a multi-dimensional approach to understanding human health. It takes into account that brain-body connection. When we think of the psycho component of this, just think of our brain, think of our mood state. When we incorporate the neuro component, thinking like neuroscience literature, when we infuse the endocrine and immunology component, hormones, our gut, inflammation, our immune system, and how it's really all interconnected. How our behavior impacts our immune system and vice versa. This field of study has looked at anxiety disorders, depression, trauma, cardiovascular disease, certain kinds of cancers, neurodegeneration, and it really helps us better understand kind of what is going on with that person at a much deeper level. The reason why I say this is a multi kind of disciplinary approach is because this field of study really pulls in research from psychiatry, neuroscience, genetics, immunology, molecular biology, endocrinology, psychology, and the list goes on and on. There are a handful of journals that are dedicated to this field of study. Health Psychology publishes articles related to this. Brain, Behavior, and Immunity is another journal I would recommend checking out. The Journal of Neuroimmunology is another really good journal. There's other journals too, but those are some of the ones you'd want to be aware of. For the psychology folks in the crowd, the counseling, the social workers, the reason why you should learn about this, because that psycho component of psychoneuroimmunology focuses on understanding grief and loss, depression, illness-related uncertainty, and how those things can absolutely impact not only our brain, but our body. Interestingly, too, if you look at this field of study, certain kinds of problematic coping patterns can actually contribute to immune system dysfunction in some cases. So, for example, if you work with clients who have a tendency to deny or conceal or repress their emotions, research points to the fact that those kinds of problematic coping patterns can actually wreak havoc on the body. So if you have clients that don't know how to express their emotions, they're in consistent denial of whatever state they're in, that can be a detriment to their immune system, their hormones, their gut, their sleep health as well. Some of the other interventions that come out of this field of study is really focusing on stress management, fatigue management, sleep improvement, depression management. If you can focus on those things, not only helps our brains work better, but it helps our bodies work better as well. So I pointed all those things out because I tend to lean on those fields of study When I present, when I do consultation, when I go on podcast, I really find it helpful to learn about those fields of study, and it's really helped me better understand complex human behavior. So as we dig into the core of today's presentation, we're going to start out with a discussion on toxic stress. In my opinion, if you work with people that have gone through extensive trauma, it's impossible that they weren't going through toxic stress. They're kind of interchangeably. So toxic stress, when I talk about that today, that's always a bad thing. Toxic stress, never a good thing. Now, there's positive stress. If someone has a job interview or gets married or has a baby or something of that nature, they probably feel stress, but it's kind of more of a good stress. Positive stress is going to be more normal. It's going to be more brief and predictable. It's going to be more managed. Chronic and toxic stress is going to be more unpredictable. It's going to be more intense. It's going to be more extreme and severe and prolonged. And over the long haul, toxic stress exposure can decrease one's coping abilities. It can wreak havoc on their brain and their body. If you are working with young children who went through toxic stress, and if those children did not receive proper support and services, there's a greater likelihood those children grow up and have more health problems. The same with adults. If you work with expected mothers who've gone through extensive stress during pregnancy, toxic stress exposure during pregnancy has been linked to more problematic birth outcomes. So going a little bit deeper into this, toxic stress exposure, it's going to be intense, it's going to be more frequent, it's going to be more prolonged. It's typically an overwhelming experience where it overwhelms that person's coping abilities. We probably all have gone through some form of toxic stress at some point. But for some people, they may have experienced this for years and years and years on end, where it has a cumulative effect, which can then negatively impact their brain and their body, which then trickles down into contributing to more cognitive problems, more learning problems, more behavioral problems. Chronic toxic stress exposure has been linked to more immune system dysfunction and growth-related problems for children who have experienced this as well. We need to consider everything I'm talking about today through a COVID lens, in my opinion. How has COVID impacted the clients you work with? COVID-19 in and of itself obviously is a huge stressor, a huge trauma. For some individuals, they may have been impacted much more severely. Maybe they lost a loved one. Maybe they got COVID and had a near-death experience and are now dealing with a great deal of fear and worry. For some people, the lockdowns were very detrimental financially. So consider how COVID-19 related stressors have impacted your clients. We need to consider that through that lens as well. There are numerous situations that can cause toxic stress exposure. A child growing up in a home that experiences neglect, that's an example. Someone that deals with long-term discrimination or racism or domestic violence exposure, or even witnessing domestic violence. So the child grows up in a home, witnesses domestic violence between the parents. That is a huge trauma, a huge toxic stressor. Economic hardship, big factor. If someone lives in a neighborhood where they're exposed to lots and lots of turmoil, violence, that's a toxic stress exposure. Food insecurity could be another example. If you work with families that are on the verge of homelessness, don't have a lot of money, don't have a lot of resources for high quality, nutritious foods, they may not have access to good foods, where maybe they're dealing with type 2 diabetes or obesity problems or some health issues, and they just don't have a lot of money. So the food they eat is highly processed, it's cheap, maybe it's food they get from the gas station, takeout, fast food, these kind of things. Those are other factors that can just amplify stress for some individuals. What about medical trauma? Maybe someone has had a long history of a lot of medical illnesses where they've had to go to the doctor repeatedly, near-death experiences. Maybe they've had a lot of surgeries. Maybe it's a parent who has a child that has a lot of medical needs, and just that parent seeing that child go through all of the medical trauma just adds extra stress to their life. We also need to be aware what happens if a child is thrusted into child protection, child welfare, termination of parental rights, a family who loses their home to a flood or a fire. The list goes on. These are just some of the examples of potential toxic stressors. And again, we know that chronic and toxic stress can wreak havoc on the human body. It can be different for everyone, depending on a number of factors, but typically the longer the stressors go on and the lack of coping strategies the person has, as they get older, they may be more at risk for increases in cardiovascular issues, certain types of cancers. It may impact blood sugar dysregulation over the long haul. Could it be a factor contributing to diabetes? In some cases, yes, the research literature points to. Kids that experience a ton of toxic stress may be more likely to be dealing with asthma. Autoimmune issues have been linked to this, increases in depression, anxiety. For some people, it could be a factor in that person turning to drugs and alcohol to cope. Without a doubt, it can impact mental health, mental well-being, and for some people, unfortunately, it could be a factor in premature death as well, depending on how long the toxic stress goes on and what kind of wear and tear has it done to their body. Other things we want to consider, we're going to talk about the HPA axis a few times today. The HPA axis is the hypothalamus, pituitary, adrenal axis. This is part of our endocrine system. Think of this axis as a chemical messenger system in the body that is related to hormone secretion. The end product of this axis is cortisol. Cortisol is a good thing. Too much cortisol is a bad thing. Not enough cortisol is a bad thing. HPA axis dysfunction can be caused by so many different factors: toxic stress exposure, the way we eat, not getting good sleep, even early social deprivation. These are all things that have been linked to more HPA axis dysfunction. Over the long haul, if this axis is more dysregulated, it's been linked to higher levels of anxiety, insomnia, mood swings, autoimmune issues, blood pressure imbalances. It's been linked to inflammatory skin conditions, hair thinning, unexplained hair loss, brain fog, increases in depression. It's been linked to having more infertility issues, unexplained weight loss, thyroid issues. I mean, the list goes on and on and on. So when you study trauma, I think it's imperative to learn as much as you can too about the HPA axis. Allostatic load, just think of this as more wear and tear on the body. Over the long haul, we're dealing with lots and lots of stress, trauma, adversity, hardship. That wear and tear can then contribute to more biological despair. It can impact our hormones. It can have a negative impact on our organs, our brain. And over the long haul, allostatic load can contribute to premature aging, more wrinkles, more gray hair. It just ages us a lot quicker. Chronic stress has also been linked to higher levels of obesity and more abdominal fat accumulation, more metabolic syndrome, more chronic kinds of inflammation issues in the body, increases in cardiovascular issues. It can have a negative impact on various aspects of brain functioning, like our prefrontal cortex, our hippocampus, and the list goes on and on and on, unfortunately. So when we think about this too, it's not just what happens after birth, but what was going on in utero? What was going on with mom during pregnancy? Was it a pregnancy full of trauma and worry and fear and uncertainty? What was mom's nutritional habits like during pregnancy? What was her financial status like? Was she living in poverty or homelessness? Did she have access to clean drinking water, healthy foods? Did she get good prenatal care? Was it a pregnancy free of tobacco products? Was it free of alcohol? Was it free of drugs? Or was there substances at play? What kind of family stressors or work related stressors was she dealing with? Was she dealing with undernutrition? Or was she overeating during pregnancy? We'll talk a little bit about sugar today. There's a couple studies that talk about excessive sugar consumption during pregnancy can absolutely be very, very problematic. What was her mental health status like, too? Was she dealing with depression or anxiety during pregnancy? What was her support system like? Were there any pre birth household challenges was she dealing with? These are just good things to be aware of. Was she dealing with incarceration issues? Was she dealing with divorce or separation or grief or loss issues? All of these things can not only have an impact on mom during pregnancy, but on that developing child in utero as well. High levels of stress during pregnancy have been linked to more preterm delivery, low birth weight, more attachment issues. As that child gets older, if they dealt with a lot of prenatal trauma, that child may be more likely to be dealing with some anxiety or depression problems or mood dysregulation issues and learning issues, and the list goes on and on and on. So we really need to be aware of what's going on in utero. A couple things that we can do to help promote a positive prenatal development. A lot of this stuff is common sense, but it's a good reminder. Maintaining regular contact with one's medical providers during pregnancy, getting good sleep during pregnancy, eating healthy, ensuring that the pregnancy is free from chemicals like drugs, alcohol, tobacco products, even being aware of caffeine intake. Too much caffeine could be a problem. So we need to be aware of that. Learning how to manage stress effectively. Exercising during pregnancy is typically recommended, but obviously doing that in conjunction with one's healthcare providers. Maintaining a normal body weight. Avoiding harmful environmental toxins is also obviously recommended. So easier said than done in some cases, because what happens if the mom was living in poverty or homelessness and exposed to a lot of environmental toxins? And really increasing that mother's overall social support. Those are just a few things to consider that can help improve prenatal development. We also need to be aware of prenatal tobacco exposure. This topic comes up quite a bit in the neurocriminology literature. There's a lot of studies that point to the fact that prenatal tobacco exposure can absolutely contribute to a host of negative outcomes as that child is born. It's been linked to having more intellectual functioning kinds of issues, so it can get in the way of academic achievement. It's been linked to having more executive functioning problems. Some kids exposed to tobacco in utero may have more hyperactivity or attentional deficits, to name a few. It's been shown to possibly impact verbal memory, language, and auditory processing, to name a few. So we really want to be aware of prenatal tobacco exposure, but also being aware as that child is born, are they exposed to secondhand smoke within that environment? These are all kinds of toxic stressors that actually have a lot to do with future problematic behaviors. Nutritional deficiencies could be another form of toxic stress exposure. So again, maybe it's because of the family does not have a lot of economic resources, so they're dealing with a lot of nutritional deficiencies, malnutrition, food insecurity. It could be the nature of the parents not having good nutritional literacy. There's a lot of factors to take into account. But during pregnancy, If the mom is not getting adequate nutrition, that can absolutely have a very negative impact on that developing child in utero. The gut-brain health axis, we'll talk a little bit about that today too. I do a lot of work in that area. It's really a fascinating area of study. So if you're not familiar with the gut-brain health axis, sometimes it's referred to as the microbiota gut-brain health axis. Basically, that field of study really shows a bi-directional relationship between the brain and the gut. So if the brain is off, the gut is off, the gut is off, the brain's off. So if you're working with clients who have severe mental health issues, typically they probably have something going on in their gut that's not working properly. Why do we want to care about this? Because the gut is the largest immune organ in the human body. The majority of serotonin is produced in the gut. Our gut impacts hormones, our nervous system. It impacts inflammation. It has an impact on our mental health. There are numerous factors that can impact the gut, either positively or negatively. What we eat can impact it, obviously. Our age, the aging process has been shown to have an impact on the gut. Our stress level, too much stress can impact the gut. How much sleep we get. Use of antibiotics, tons of antibiotics can have a negative impact on the gut. Lack of exercise. So if you work with clients that live a sedentary lifestyle and don't get a lot of movement, that can have a really negative impact on overall gut health functioning. Overuse of alcohol, tobacco products, tons and tons of stress. These are all things that can have a very negative impact on gut health functioning. We also need to be aware, again, what's going on with caregivers. And one intervention that I think is always very helpful to do is if you're working with parents, teaching them the importance about caregiver regulation. Parents who are well regulated while parenting typically are modeling much better behavior to their child, and hopefully that child will grow up and have better self-regulation. Parents who are extremely dysregulated during parenting, children can become more dysregulated, more irritable. It can impact their sleep health. Parental self-regulation, very, very important component to consider within this context. What are a few things you'd want to consider if you're working through a family systems lens in terms of helping parents improve self-regulation? Self-sufficiency, helping that parent develop increased resilience can be a very helpful strategy to use. Helping that parent gain more resources and access to different services and supports, and helping that parent develop more knowledge and skills around effective parenting practices can be very helpful. Teaching that parent improved self-efficacy. So if that parent does not believe in their own abilities to be an effective parent, a lot of times they might not be an effective parent. So helping them develop skills so they feel more competent in their own parenting abilities can be very, very helpful. Teaching that parent self-management skills can be very helpful. Part of self-management is teaching self-monitoring skills, self-evaluation skills, setting realistic goals. These are all things that can be very, very helpful. Teaching the parent improved problem-solving skills can be very helpful. Conflict resolution skills, and improved decision-making. If we can infuse those kinds of strategies and interventions into the good work you're already doing, hopefully in theory, that can trickle down and help that family system reduce toxic stress exposure. We also need to be aware again of economic strain, economic hardship, poverty, homelessness. If you look at the economic hardship literature, it talks about food insecurity. It talks about being aware of that family possibly not having a lot of material resources. So, do they have access to books, computers, Wi-Fi? These are all things that can have a very negative impact on that family if they don't have resources just to the kind of the basic materials. Economic hardship has been linked to having greater difficulty in finding affordable, stable, and safe housing. Very important to consider that topic as well. Economic hardship has also been linked to that family having fewer opportunities for leisure or social activities that are positive. It's also been linked to increases in stress, more social isolation. It puts more strain on that entire family system. So it could contribute to more conflict, more marital or parenting dissatisfaction. And it could be a factor in some cases of domestic violence and child abuse and economic hardship over the long haul. If we look at it through a toxic stress lens, can absolutely have a negative impact on child development. It can impact the sleep health of everyone in that family system. So we really want to be aware of the topic of economic hardship as well. Do you work with clients who are perfectionistic? This can absolutely be an accelerant for stress for that individual. So if a client is dealing with this, do they have that need to always be perfect, to always overperform? If they do, that can set that person up for a lot of stress because they always have to be perfect then, and no one can be perfect. And that can absolutely erode their coping skills. They might be more self-critical. They might be more critical to other people. If you take a look at this particular slide, it's been linked to having more health problems. In some cases, it may increase the risk for eating disorders, addictive behaviors, and it's actually been linked to decreased cognitive functioning as well. So being aware of this topic, I think screening for it, taking this into account during an intervention can be very helpful because again, if this person puts like impossible high standards on themselves and others, they're going to burn bridges with themselves and other people. Do they have a fear of failure? Are they hypercritical of the relationships they're in with other people? Does this trickle down into having more self-defeating thoughts or behaviors? This is a problematic thinking pattern and style. If you work with clients who are the survivors of bullying victimization, this is a type of trauma, a type of toxic stress exposure. Bullying victimization, unfortunately, is very common. It's actually even more common among certain kinds of special needs populations. Bullying is an intentional act. There's a power imbalance between the victim and the perpetrator. It can involve one-on-one with another person. There can be group dynamics to this. There's many different forms of bullying. You have physical types of bullying. This is where like kicking or hitting or punching is involved. There's a kind of bullying called relational bullying. This is where gossiping or ignoring occurs. There's verbal bullying. Typically, that's probably the most common form where more insulting behaviors, name calling. There's something called material bullying as well, where someone damages or steals the property of another individual. And then we also absolutely need to be aware of the topic of cyberbullying. So I've consulted on several cases the last few years where cyberbullying, cyber harassment has been a factor. I do a lot of consulting in the areas of like neurodevelopmental disorders, traumatic brain injuries, and a lot of the cases I've consulted on, when they have those diagnoses, they seem to thrust themselves into the online world. The reasons for that, I suspect, in some of these cases, is because they're dealing with a lot of social skill impairments where maybe they struggle with connecting with people face to face. But in the online world, they feel more comfortable. But in some of these situations, the client was taken advantage of. They were more gullible. They were more naive. They didn't realize that the other person online was trying to take advantage of them. So we need to be aware of cyberbullying, cyber victimization. The research through a neuroscience lens on bullying victimization is vast, and it's very concerning. Long-term bullying exposure has been linked to more long-term changes in the brain. So it can contribute to more cognitive problems, emotional deficits. The reasons for that is because it can be a toxic stress exposure. It's been shown to contribute to more HPA axis dysfunction. It's been shown to impact sleep health, our immune system, and it's even been shown to impact our hormones in our body. The long-term effects of bullying have been linked to having more anxiety problems, more depression, more trust issues. There's some studies that show that bullying can absolutely have an impact on the gut-brain health axis. It's been linked to having more somatic complaints, so like more chest pain, back pain, headaches. It's been linked to having higher blood pressure among some individuals, greater levels of loneliness. For some individuals, by no means am I saying everyone that's been bullied will have antisocial kinds of behavior, but long-term bullying victimization could contribute to that person having more kind of antisocial behaviors as they get older. The reason for that is, in some cases, is it could be anger rumination where they perseverate about getting back at other people. They just feel so rejected by society. They start becoming more angry, more aggressive. They might start engaging in more self-destructive behaviors. So we really want to be aware of that. The consequences of bullying, again, are many and varied. How does the client handle conflict? People that cannot handle conflict well, it could absolutely contribute to increases in toxic stress. And then that can trickle down into having more behavioral, emotional, physical, cognitive, social problems. The consequences of unresolved conflict have been linked to having greater negative emotional mood states. People that cannot handle conflict or manage it effectively might complain more of physical health complaints. So again, more of those somatic complaints, the headaches, the chest pain, the stomach aches, more sleep issues. For some of these individuals, they may have increases in fear and worry and anxiety. It can absolutely impact how they function at school, on the job, with family and friends. It can impact their decision making and how they communicate with other people, to name a few. So this is another area to screen for and to be aware of. If they struggle with managing conflict, this could be a very important target area for intervention. So that first section kind of walked us through toxic stress exposure. Now, as we move deeper into the world of trauma, we're going to talk about the adverse childhood experiences research. If you haven't had any training in the ACEs research, this relates to traumatic events that occurred to your client before the age of 18. Typically, a lot of this research really looks at how trauma impacted children early on, like in development, but we need to take into account prenatal trauma. It's not just what happened after birth, but what was going on in utero. The adverse childhood experiences research, the first study was published in 1998. If you go to the Centers for Disease Control and Prevention website, they have a very nice page dedicated to that first study. Since that first study, there have been numerous studies that have looked at various dimensions of the adverse childhood experiences literature. The ACEs research absolutely is related to toxic stress exposure. Over the long haul, this can wreak havoc on the body because of chronic inflammation, amongst other things. The ACEs research really encompasses experiences of abuse, so really looking at histories of emotional, physical and sexual abuse. Parental incarceration is a type of adverse childhood experience. So a child grew up and had a caregiver who was incarcerated. That is an example. A child who grew up in a home where they witnessed domestic violence between caregivers, exposure to a great deal of household dysfunction, having a parent with a drug or alcohol problem could be classified as this, and having a parent with a severe mental health issue that's typically untreated is another example of this as well. We also need to break down household dysfunction. What could that be? High conflict divorce would be the example. The parental incarceration would fall under that umbrella. Parental mental health, and then witnessing a parent being abused by another parent. Those are examples that would fall under the umbrella of household dysfunction. We need to be aware, is there any history of neglect as well? Physical neglect, emotional neglect, and then the various dimensions of abuse. Since the first study, again, several studies have looked at different dimensions. They've looked at how bullying can be now classified as an adverse childhood experience. So maybe the trauma didn't happen directly in the home, but it happened at school. Poverty could be classified as a potential adverse childhood experience. Peer rejection, racism, death of a loved one, so traumatic loss of maybe a loved one early on in life, exposure to community violence, food insecurity, the list goes on. So basically what this research found is that the higher numbers of traumas that that client experienced before the age of 18, and if those traumas never were addressed through treatment or intervention, there's a higher likelihood that that client grows up and has more health problems. There is some literature that supports the fact that people with very high ACEs scores might be more likely to come into contact with the criminal justice system for a variety of reasons. They might be more likely to have more relationship dissatisfaction and relationship failures. There's some studies that show too that people with higher numbers of ACEs might have a higher broken bone history in their lifetime too. That can be from a variety of reasons, from direct abuse to risk-taking behaviors to getting into fights, increases in depression, increases in problems in work, and the list goes on and on and on. So this is a really big topic that we are going to talk about quite a bit today. Other things we want to be aware of: long-term consequences of extensive exposure to trauma in childhood has been linked to greater depression in adulthood, increases in suicidal thinking and behaviors, increases in the risk of being diagnosed with post-traumatic stress disorder at some point later in life. The reason for that partially is the fact that if that person went through a lot of trauma in childhood, did that erode their resilience, and then they got exposed to another kind of trauma, we need to be aware of PTSD. We need to be aware too that there is a link between this and increases in drug and alcohol use. Unfortunately, some studies have pointed to the fact too that extensive exposure to childhood trauma untreated may increase the risk of heart disease, certain kinds of cancers, chronic lung related problems, the potential of engaging in unhealthy or unprotected sexual practices that could lead to increases in sexually transmitted diseases. We need to be aware too of social problems that are linked to this research, or increases in homelessness, prostitution, criminal behavior, more parenting problems, more long-term unemployment issues, and unfortunately, for some individuals, it can shorten their lifespan as well. And part of that is linked to that allostatic load I mentioned before. Higher numbers of ACEs have also been linked to greater levels of smoking, increases in obesity, living a sedentary lifestyle, and the list goes on. So again, if you are working in the criminal justice system, you're probably working with people that have been exposed to trauma frequently at various points in their life. If you're working in the clinical or human service or social service arenas, again, very important to understand these topics. So let's just talk again briefly about allostatic load. I think it's important just to recap that, what that is, because this links directly to this field of study. Allostatic load relates to wear and tear on the body. Think of it as a cumulative burden of chronic and toxic stress exposure that can then contribute to more neurological issues, more endocrine system problems. It can have a profound impact on all facets of the human body. And there are a number of different things that can increase allostatic load on top of trauma. So if someone's not sleeping well, they're not taking care of themselves nutritionally, they're not getting good exercise, they're in a just conflicted relationships, they just never sleep well. These are all things that can contribute to allostatic load, unfortunately. Now, when we talk about the adverse childhood experience, we need to be aware of maltreatment. We need to be aware there's many dimensions of trauma: neglect, interpersonal trauma, complex, developmental trauma, even abusive head trauma. We need to be aware of that topic as well. Whatever kind of trauma it is, children who are exposed to a lot of abuse or neglect early on in life may present, as they get older, with more learning challenges, more problem-solving deficits. In some cases, it can have an impact on IQ functioning. They may be more likely to be dealing with some planning or organizational deficits. It could impact language capabilities as well. So it can impact really all facets of life. Through an emotional dysregulation or behavioral lens, childhood trauma for some children have been linked to having more aggressive tendencies. They might be more likely to exhibit more like oppositional kinds of behavior. They could come off as more stubborn. They might come off as more withdrawn. If any of you are working in the educational arena, extensive exposure to childhood trauma has been linked to multiple educational deficits. So if you work with children who present with a lot of attentional problems, learning problems, they come to school checked out, they seem to be chronically sleep deprived, they're confused, they just seem to be very inflexible in their behavior, they just seem to not get along with other kids. Has anyone screened them for potential exposure to trauma early on in life? I'm not saying all kids that present with those behavioral problems would exhibit or deal with some sort of trauma, but I think it's worth considering it. And again, if you're working in any of these fields of study, learning about trauma is going to be very helpful, and becoming really trauma informed and trauma aware, very, very helpful. This is the citation for that first study that I referred to before. So this was the first adverse childhood experiences study. You can find this online. You can go to the CDC's website. The topic areas from the adverse childhood experiences survey they used in this first study, they looked at frequent insults, humiliation, or fear of physical harm at home, looking at that history of the clients they surveyed. They looked at histories of exposure to frequent physical violence, sexual abuse, that frequent feeling of not belonging to one's family of origin, neglect histories. Was there parental divorce or separation? Was there abuse of one parent by the other? Substance use within that family, a mentally ill family member, and parental incarceration. Since that time, again, several other studies have looked at all kinds of other different dimensions of the adverse childhood experiences research. So we talked about toxic stress exposure during pregnancy, really just being aware that if mom experienced a lot of trauma when she was a child, and if she got older, got pregnant, and didn't deal with that trauma, didn't have proper supports and services in place, That's been linked to having more problematic birth outcomes in some cases. So we really need to be aware of how this not only impacts mom, but the next generation. So I think it's very important too. We really be aware of like the topic of intergenerational transmissions of trauma and really thinking about this from a family lens, a generational lens. I think it's very, very important. So I mentioned chaotic home environments before, but what would this look like? What would be some examples of a like potential chaotic home environment? Growing up in a home, abuse, neglect. Maybe there wasn't any abusive neglect directly, but there was some abandonment issues. So we want to be aware of parental abandonment. Did that child grow up in a home where one of the parents was non-responsive, the parent was very frightening to the child, or just unpredictable, where the parent's on it 1 minute and the next minute they're completely a different person? Forced separation from a caregiver could be an example of this as well. So maybe the family is thrusted into the child welfare arena. Frequent placement moves, maybe the parents, they consistently move, they're couch hopping, they're dealing with a high level of poverty or homelessness. These are examples of potential kind of chaotic family systems environment. I think when you work with a family that would fall under this umbrella, obviously digging deeper what's going on in the family, getting them the proper supports and services, but really finding out what's the relationship dynamics with the family members. What's the parenting abilities? Remember, we talked about parental self regulation just a little bit ago, thinking of that topic as well. Do the parents know how to stay regulated? Do they know how to parent effectively? Do they understand healthy parenting practices? What are the technology use habits in the family? Does the family have meals together? Is there unemployment going on in this family system? Does the family have a lot of hobbies? Considering cultural considerations, spiritual beliefs, the list goes on. So, really, just digging into that, the family system is going to be very, very helpful. Harsh parenting practice is a form of trauma. So, a parent who engages in harsh parenting practices, this would be a parent who might present as extremely overly strict or overly authoritarian. It could be a parent who uses like fear-based approaches. They could come off as very non-empathetic to the children. Do they utilize a shame-based approach to their children? Are they really threatening or critical? Or do they have rage control problems where they yell and scream and swear? Do they utilize verbal or physical threats as punishment? And do they use guilt when interacting with their children? Those are all examples of potential harsh parenting practices. And over the long haul, the research is pretty clear on this. Children who grow up in these home environments, they might be more likely to experience more self-regulation deficits as they get older because these experiences can overwhelm the child. The unpredictable nature of some of the parents that would fall under this umbrella can confuse the child. It can make them feel helpless, hopeless, or angry. And as that child gets older, they may really struggle with just controlling their mood states in school. What happens if a parent is emotionally invalidating to the child too? Emotional invalidation, really think of it as a form of emotional abuse where that parent has a tendency to minimize the child. This can increase symptoms of anxiety and depression in that child. It can contribute to more self-worth issues, self-regulation issues, and that child can really feel like they're a failure or somewhat defective. So we need to be aware of emotional invalidation as well. So we really want to help these families thrive. So what do we do about that? I think it's important to become trauma informed, attachment informed, teaching the family improved problem solving skills, stress management skills, maybe using some family centered kind of problem solving, increasing their locus of control, focusing on improving parental self-efficacy, helping that family system develop some consistent structure and predictability. These are all things that can be very helpful in helping that family thrive. So back to the HPA axis again. So the hypothalamus, pituitary adrenal axis, we really want to be aware that early life stressors can have a very negative impact on this axis. So problems associated with HPA axis dysfunction, it can absolutely contribute to neurobiological alterations. It can suppress the person's immune system over the long haul. It's been linked to having more cardiovascular problems as that person gets older, increases in anxiety. It can impair their stress tolerance. It's been linked to having more attentional problems. And for some individuals too, HPA axis dysfunction has been linked to having greater levels of suspiciousness and psychotic symptoms among some individuals. So really fascinating topic. So again, the causes for HPA axis dysfunction are all over the map. A big one is going to be trauma and stress, but digestive health issues contribute to this. Infection, so maybe someone sustained an infection, never went to the doctor. Lack of sleep, lack of exposure to the sun, where maybe they have lower levels of vitamin D. That's been linked to more dysfunction in this axis. Chronic loneliness has actually been shown to negatively impact the HPA axis. Overeating, undereating, having a diet that is full of processed foods, so like the Western diet, that can be a factor in this as well. So the list goes on and on and on. So again, this is just a big topic that I'm going to continue to talk about throughout today's training. Adverse childhood experiences, toxic stress exposure can absolutely impact the brain and particularly the prefrontal cortex. Why do you want to care about the prefrontal cortex? Because it really involves our executive function, the boss of the brain, the CEO of the brain. It plays a critical role in our thinking, in our behavior, our emotional regulation, our decision making, how we solve problems, and it even plays a role in personality expression. So if you work with folks in the criminal justice system, individuals with high levels of trauma, extensive mental health, substance use issues, more times than not, they're probably dealing with some level of prefrontal cortex dysfunction. So executive function, just think of this as a multifaceted, multidimensional neuropsychological construct. It's been referred to as the boss of the brain or the CEO of the brain, and it underlies adaptive human behaviors. So if you work with clients through like a psychiatric rehabilitative lens or a skills building lens, it's imperative to understand executive functioning capabilities. Executive function plays a role in theory of mind development, emotional regulation, social competence, moral development, school readiness. Goal-directed behaviors are at the core of executive function. So if you are developing any kind of goal plan, intervention plan, treatment plan, becoming executive function informed is absolutely imperative. What is at the heart of goal-directed behaviors? The client's ability to engage in flexible thinking. Are they action-orientated? How do they plan for the future? Do they know how to prioritize? Do they know how to resist distractions? So you're talking to them, are they able to stay focused on you, or do they get off track really easily? Can they manage stress and disappointments effectively? Planning, time management, organization, decision-making, those are all goal-directed behaviors. People with executive functioning impairments may have limitations in some or many or even all of those areas. So really be aware of that. For some people with executive functioning impairments, It can also impact performance and how they process information. And they might have more difficulty with multitasking or transitioning from one topic or one subject to another. Working memory falls under this umbrella, cognitive flexibility, inhibition, abstract reasoning and thinking. There are many dimensions of executive function. Those are just a few of the ones that you would want to be aware of. So other things you'd want to consider under this umbrella: vocabulary, visual spatial skills, intellectual functioning. So if you're working with a client who has executive functioning impairments, it could be linked in some cases to that client having more depression, more substance use issues. If you're working in substance use treatment, if you're not taking into account executive functioning capabilities, you're missing a critical component. There's a very high likelihood, if you're working with folks in drug or alcohol treatment programs, are probably dealing with some level of executive function impairments. Chronic exhaustion has actually been linked to having more executive functioning impairments. Sleep problems, not eating healthy, obesity, not being able to manage stress effectively. These are all been linked to having more problematic outcomes with executive function. Some red flag indicators that you would want to be on the lookout for when working with clients who might present with executive functioning impairments. Task completion issues is the big one. The client just really struggles with completing a task. They just don't know where to start. They don't know where to end. They get lost in mid-sentence. They get lost with directions. Chronic forgetfulness could be a red flag indicator. This has actually been linked with having more social skill impairments, more forward thinking deficits. It's been linked to also having more self-awareness problems, disorganized thinking, memory issues, the inability to manage change effectively. The list goes on and on. Those are just a few things you'd want to consider. If you work with clients with executive function impairments, if you have the resources, referring that client to get some cognitive testing or work with like a neuropsychologist to kind of get some good testing, some good data to figure out what domains of functioning are working, what domains aren't, and then using that data to develop an executive functioning informed goal plan or intervention plan, I don't think you can go wrong. Children exposed to toxic stress, trauma, adversity, hardship, it can absolutely impact cognitive functioning and their executive functioning capabilities. So if you are becoming trauma informed, in my opinion, it's equally important to not only understand the HPA axis, but also executive function. I know I'm asking a lot of you guys, but if you can learn about all of those topics, I think you're going to be in a much better position to, again, understand confusing, concerning, problematic, and even criminal-based behavior. The studies go on and on and on. So again, for some clients with these issues, with co-occurring trauma and executive functioning impairments, the client may deal with more frustration, greater levels of fear and exhaustion. They might deal with more embarrassment, where they have a hard time connecting the dots and they just aren't picking up on social cues. For some of these clients, they may be dealing with more social isolation, more worry. It could be a factor in substance use for some of these clients, higher levels of shame. It can absolutely impact the quality of relationships with other people. It can impact conflict resolution abilities. It can even contribute to self-defeating and avoidant kinds of behaviors, to name a few. There are a number of different skills, strategies, and interventions that can help improve executive function. A couple that I'll just point out now is anything you can do to help that client really promote positive relationship building. That's a big thing, forming a positive relationship. highlighting the client's strengths, skills, qualities, and attributes. So using some positive psychological interventions can be helpful. Teaching the client ways to improve problem-solving abilities, organization, time management, and planning abilities are very helpful. I'll give you another tip. If you work with clients who have time management, planning, and organizational deficits, those are all red flag indicators of executive function impairments. Teaching the client how to manage time more effectively, self-monitoring skills and self-advocacy skills can be helpful. Exercise has been linked to improvements in executive function, eating healthier, getting better sleep. And it's very, very important too, in my opinion, to really individualize the approach with the client, because every client you work with obviously presents with different needs, different strengths, different limitations. So really individualizing the approach and taking into account as well the client's not only chronological age, but their emotional and their developmental and their social age as well can be very, very helpful. When we talk about self-regulation, I use them really interchangeably with executive function. They're pretty much the same thing in my opinion, but depending on what research study you take a look at, it could differ a little. There's a high likelihood if you're working with folks who engage in criminal-based behavior, they're going to be dealing with some level of self-regulation deficits. So it's very important to understand this topic as well. The causes for self-regulation issues are also really all over the map. They're many and varied. Prenatal trauma, postnatal trauma, caregiver unresponsiveness can contribute to this. Remember the emotional invalidation we spoke about a little bit ago? Head trauma. You work with clients with a neurodevelopmental disorder. Typically, there's going to be some level of self-regulation deficits. This is a big topic. There's many dimensions of this. So if we were to break down self-regulation, we have affective components. So this is basically your client's ability to manage and understand their own feelings and their ability to label and recognize emotions in themselves and others. If you have clients that struggle with that, that could be indicative of self-regulation deficits in the affective domain. Behavioral problems. So for example, if you work with clients who have impulse control problems, they struggle with delaying gratification, they can't stick with a particular task, those are red flag indicators of self-regulation deficits in the behavioral domain. In the cognitive domain of self-regulation, that's where we have like working memory, problem solving, planning, focused attention, and attentional shifting, to name a few. There are a number of building blocks associated with self-regulation. So how do we support this early on in life? Obviously prenatal, healthy prenatal development and early childhood development, but focusing on enhancing working memory skills, social skills, promoting sensory processing abilities, really focusing on enhancing language development early on, focusing on enhancing emotional and behavioral and attentional and concentration development are just a few things you'd want to consider. And if you work with clients who struggle in these areas, they might have greater difficulty managing frustrations, handling embarrassing situations. They might become more overwhelmed in certain situations, particularly when they're confused, when change happens. Be on the lookout for this. This can contribute to more emotional dysregulation in some of these clients. When we work with all of these clients too, through this trauma lens, through the executive function lens, it's imperative to understand attachment. We know from the criminology literature that attachment problems are quite common in chronic offender populations. They're quite common in clinical settings as well. They're very common among people that have been exposed to extensive childhood trauma. Attachment influences our thoughts, our feelings, and our actions. The benefits of having solid, secure attachment patterns have been linked to having greater levels of resilience against stress. It's been shown to play a critical role in increases in moral reasoning and moral development. It promotes increases in sensitivity and empathy. It's been linked to having greater levels of self-efficacy. Typically, people with greater attachment patterns, healthy attachment patterns, are able to handle things more effectively. They do better in school. They can learn social skills more effectively. So very, very important to be aware of the topic of attachment. There's several attachment styles out there. You have secure attachment, there's anxious attachment styles, there's avoidant, and there's anxious avoidant attachment. There's other ones out there too, but those are kind of the big ones you want to be aware of. When you study the adverse childhood experiences research, it's very, very important to be aware of the topic of attachment-based adverse childhood experiences. We need to be aware too that attachment trauma can occur in utero. So, for example, mom's pregnant. What kind of trauma did she deal with during pregnancy? Was it an unplanned pregnancy? Was the pregnancy as a result of a sexual assault? Drug use, alcohol use during pregnancy can contribute to this. Medical traumas that the mom experienced, chronic sleep deprivation, nutritional deficiencies, domestic violence exposure during pregnancy, the mom living in a chaotic home environment, witnessing violence, exposure to community violence. Maybe the mother is dealing with a high level of maternal guilt and shame. So again, all of those traumas not only impact mom, but it impacts that developing child in utero. Other things we want to take into account when we're starting to look at problematic attachment patterns. I talked about emotional invalidation before, so we really want to be aware how that could be a factor in some of these situations as well. For some of these children who are dealing with these traumas and have disorganized attachment patterns, it could trickle down into having more behavioral control issues. So that child may start exhibiting more unpredictable behavior. They might start exhibiting more impulse control issues, emotional outburst. They might start exhibiting more anger, aggression, violence, defiance behavior. And as that child gets older, this could be a factor in that child engaging in potential criminal behavior. This slide also reminds me of the importance, if you work with people that have a long-standing pattern of engaging in risk-taking behaviors. So these would be like behaviors that are harmful to themselves or others. It could be risky social behaviors, risky sexual behaviors. It could be risky driving behaviors. Maybe it's a long-standing pattern of risky financial behaviors. They're starting to engage in a lot of substance misuse. Look through an attachment lens, look through a trauma lens. Maybe there's something going on there that's contributing to those kind of behaviors behind the surface. When we're talking about all these things too, we need to be aware of internalizing symptoms. So if that child, teenager, or adult is dealing with internalizing symptoms, these are symptoms that are experienced inwardly by your client. So like internal distress, they might feel more anxious, more afraid. This can be linked to higher levels of irritability. They might worry about the future more often. They might feel more self-conscious. They could feel more nervous or sad or lonely or withdrawn. And internalizing symptoms have also been linked to experiencing more somatic symptoms, sleep issues, headaches, stomach aches, the list goes on. High levels of internalizing problems in some cases have been linked to higher levels of shame. And shame in and of itself is a toxic emotion, and that can contribute to some clients withdrawing, having greater levels of depression, more self-esteem issues, higher levels of anxiety, and even feeling more worthless. On the flip side of the spectrum, we have externalizing behavioral problems. These are going to be much more easy to detect on face value. These are clients that might be more aggressive, more impulsive. They could come off as more agitated, more disobedient, and more oppositional. This can be linked to more conduct problems, more risk-taking behaviors, and it's been linked to having more adverse outcomes throughout the lifespan and more mental health challenges as well. Unfortunately, too, children with externalizing behavioral problems may be more likely to have more school issues as well. So they might have more delinquency. They might be more likely to drop out of school. They might be more likely to not go to school, higher levels of absence, more learning challenges. Externalizing behavioral problems in children, too, if you look deep into this literature, have been linked to more reading problems, more issues with understanding vocabulary, concentration deficits, and comprehension issues, problems with spelling, and problems with verbal fluency, just to name a few. So we need to be aware of internalizing problems and externalizing problems. A lot of times, in my experience, when I've consulted on cases, nearly every case I've consulted on where there has been externalizing problems, they usually have internalizing problems as well. But I've consulted on cases where that's not the same if the person only has internalizing problems. Sometimes they may not have any externalizing problems. They're just experiencing all of the distress inward. And before we move on from this slide, there's some risk factors just to be aware of that can contribute to greater levels of externalizing behavioral problems. Growing up in a home where there's lack of parental involvement, lack of parental supervision, monitoring, harsh parenting practices, inconsistent punishments, these are all things linked to greater levels of externalizing behavioral problems in children. When you hear me talk about social cognition, this is the umbrella term for how the client really perceives information, makes sense of it, processes it, uses it within the social context. It involves perception, attention, decision-making, memory, and emotions within the context of the social arena. When people have deficits in the area of social cognition, it can absolutely get in their way of pro-social relationships, emotional self-regulation, empathy, perspective taking, all of these things. So if you work with clients that have a long-standing history of social skill limitations, if they came into contact with the criminal justice system as a result of like social skill deficits, look at it through the lens of social cognition. I think it will help you better understand maybe what's going on with that client. Social cognition also is linked with moral reasoning, mentalization, theory of mind, empathy, and even group behavior, to name a few. Be aware of the topic of language. The reason why I point this out is if you start looking at like the forensic literature, a high percentage of people in prison have language-based impairments. This is very important to consider. I think it's not taken into account quite a bit within the criminal justice system as a possible contributing factor. Promoting language development early on in life, identifying children that might have some language limitations or deficits can be very, very important for long-term success. Because language development obviously plays a critical role in so many things. It's how we carry on a conversation with other people. Friendship making abilities is linked to this. The ability to tell a story or use humor effectively. It's even linked with rule following behaviors. Very, very important to consider language development. If you work with young kids or families that just had a baby, we want to be aware too of like pre-language skills. So understanding the literature related to like gestures, facial expressions, smiling, listening, imitation, even joint attention, social referencing, mind-mindedness. These are all things you'd want to consider. And language has absolutely been talked about too within the context of self-regulation. So people with greater language abilities typically are in a better position to like name their emotions, and that can help them manage their feelings more effectively. People that struggle with language and they really struggle with communication, this can trickle down into having more self-regulation deficits. There are numerous things that can cause language problems: prenatal trauma, early childhood trauma, failure to thrive issues, certain types of birth defects, premature birth in some cases, nutritional deficiencies, neglect, head trauma, being diagnosed with a neurodevelopmental disorder. Over the long haul, if someone has a true language disorder, it can have a profound impact on academic performance, their emotions, their social skills, and even their cognitive health as well. So working hand in hand with like a speech, language, and communication pathologist might be highly recommended. Theory of mind falls under the umbrella of social cognition. There's actually more and more articles coming out in recent years that talk about theory of mind deficits within the context of the criminal justice system. It's a very important topic to be aware of. People with high levels of trauma might be more likely to have deficits in this area. Theory of mind relates to that client's ability to understand the internal mental states of other people, like beliefs, desires, motivations, misconceptions, presumptions, and even intentions of other people. There's various dimensions of theory of mind. This literature is vast. There's thousands of studies that have been published on this within the context of so many different kinds of factors and disorders. There's cognitive theory of mind, there's affective theory of mind, there's something called interpersonal theory of mind, and intrapersonal theory of mind. When theory of mind is working properly, it plays a critical role in verbal comprehension, how we use nonverbal cues, plays a critical role in our thinking, like critical thinking abilities, reading comprehension, and group and interpersonal behavior. Studying theory of mind literature, you're going to realize that there are many precursors that help promote positive theory of mind development. Promoting healthy attachment, understanding the literature on joint attention, pretend play plays a critical role in theory of mind development. So if you have a child who grew up in a very neglectful home and did not have an opportunity to play and interact with other kids, play make believe, maybe they grew up in a home where parents just didn't engage a lot with them, didn't use a lot of words. Those are all things that can negatively impact theory of mind development. Language skills relates to this. How many siblings were in the home could play a role. Parenting styles play a role in this as well. And theory of mind is one factor of many that plays a role in moral judgment and moral decision making. So does empathy, so does abstract reasoning, and so does executive control, to name a few. So hopefully laying the foundation that theory of mind is a really important topic, because if you work with clients with theory of mind deficits, they might have a very difficult time understanding complex emotions. It's actually been linked to having greater difficulty in understanding and using deception. So some of these individuals may be more gullible and have a hard time detecting when someone's trying to take advantage of them. This gets in the way of perspective taking, to name a few. So theory of mind, big, big topic. Trauma and insecure attachment patterns have been linked to having more theory of mind deficits as well. This has also been linked with having greater perspective taking deficits. So if someone has perspective taking deficits, that client may have a really difficult time considering or perceiving another individual's point of view. So they might have a hard time like working in a group format. They have a really hard time like setting aside their own thoughts, feelings, emotions, where it just kind of looks like it's all about them. So if you work with clients that have a long-standing pattern of having relationship breakdowns, they can't seem to get along with other people in groups, they come off as just really one-sided, they could always appear distracted or cold or callous or bored when you're talking to them, those could be potential red flag indicators of theory of mind and perspective taking deficits. Children exposed to intimate partner violence obviously is a type of adverse childhood experience. We know, unfortunately, intimate partner violence is all too common in our society, but the research points to the fact that children who witness intimate partner violence might be more likely to grow up and exhibit some of those externalizing behavioral problems I mentioned before, higher levels of aggression, more hyperactivity issues. It's also been linked to some children engaging in more bullying behaviors, lying, cheating. These are very important things to be aware of from an early intervention standpoint. Poverty was not included in the original adverse childhood experience study, but since that time, they have looked at, does poverty really, should it be classified as a potential adverse childhood experience? And the research points to, yes, children that grew up in poverty may be more likely to have more health problems, more cognitive impairments. It really depends on a lot of factors, the level of poverty, the duration, the timing of it. But we need to be aware too that poverty, in some cases, could expose that child to greater levels of household dysfunction, distress, separation of the family. This is a really good study that just talks about it a little bit more. Poverty within that family system has been linked to more caregiver instability. In some cases, it could be a factor in some of the parents turning to drugs or alcohol. Exposure to increases in community violence in some cases. Children exposed to long-term poverty or homeless situations are more likely to experience some cognitive deficits. So we want to be aware of executive function impairments, sleep problems, nutritional deficiencies. Some of these children may have been exposed to higher levels of environmental toxins like pollution exposure, endocrine disruptors. They might be exposed to more victimization. For some of these children, they may be more likely to sustain a head injury. Unfortunately, it can absolutely impact their ability to go to school, get their homework done, their ability to interact with other kids. So it is a potential trauma that we absolutely need to be aware of. So we spoke about bullying a little bit before, but again, just be aware that now bullying really is classified as a type of adverse childhood experience. So bullying, that bullying victim dynamic, you could have those individual factors. We need to be aware of peer factors. Even in some cases, there could be family, school, or community factors at play. So we have direct, overt forms of bullying. This could be verbal or physical. We talked about that before, but you could also have indirect or covert kinds of bullying. The cyberbullying and the relational bullying we spoke about before. So we really want to be aware of this as well. Peer victimization, peer violence has been linked to having more health issues, insomnia, anxiety, higher levels of restlessness, harm, like that fear of like going to school and being harmed, greater levels of depression, greater levels of daytime fatigue. So we really want to be aware of this. And for some of these kids, if they're sleep deprived, they're dealing with a lot of trauma at home, they're dealing with peer victimization or violence. For some of these children, they may be dealing with higher levels of hyperarousal issues or hypoarousal issues in schools. So they could present as being more defiant or having more learning problems when in fact it could be chronic sleep deprivation and untreated trauma as well. So we really want to be aware of those dynamics. There is some literature also to point to the fact that children with higher levels of adverse childhood experiences may turn to the screen more frequently. So excessive screen time exposure really is a threat to emotional and behavioral health as well. So digging into how much time that client is on the television, on computers, smartphones, on video games, tablets, social media, those kind of things. Family dysfunction has also been linked to children being more likely to be on the computer or the screen for longer periods of time. Unfortunately, excessive screen time exposure has been linked to having more academic problems, increased likelihood of living more of a sedentary lifestyle. It's been linked to having more sleep problems. It can have a negative impact on our mood state and our physical health, just to name a few. And unfortunately, too, if you look at some of the literature on the negative effects of excessive screen time exposure on adolescents, it's been shown to drive up anxiety, depression, loneliness, and it's been shown to reduce overall quality of life and well-being for some adolescents, unfortunately. Sleep is a big, big topic to consider through a forensic criminal justice lens. I don't think people really consider how important it is to consider sleep. Now, we consider it within the context of trauma, and we know, unfortunately, when you're working with trauma survivors, a higher percentage of these individuals may be dealing with sleep-related complaints, but there are several studies too that show that chronic sleep deprivation could be a factor in some cases of anger, violence, aggression, and full-blown criminality. So becoming sleep informed, screening for sleep, understanding how sleep can impact all facets of functioning. Insomnia is the most common sleep issue, but being aware too of sleep apnea, restless leg syndrome, periodic limb movement disorder, parasomnia, the list goes on. Work with a sleep specialist, very important. Rule out sleep issues. Maybe you are a sleep specialist, a sleep coach. You have some training in like sleep hygiene or cognitive behavioral therapy for insomnia. Because if you just look at insomnia symptoms, chronic insomnia has been linked to more anxiety, more memory problems, more concentration issues, more depression, higher levels of irritability, and increases in accidents and errors, just to name a few. And if you combine trauma and sleep together, that's been linked more anxiety, agitation, depression, increases in nightmares, greater fear of the dark, just a fear of being alone. It can absolutely contribute to symptoms of hyperarousal issues that we spoke about before. So just really be aware of that topic. A topic that I don't think is talked about a lot is this called sluggish cognitive tempo. A lot of studies have been done on this, and some studies have found that children that experience interpersonal trauma may be more likely to experience sluggish cognitive tempo. Sluggish cognitive tempo resembles signs of inattentive ADHD. The client will typically look like they're more withdrawn, more checked out, kind of more spacey, more apathetic. They just kind of seem slow to respond to questions. They have a really hard time staying alert in boring situations. They could come off as being really unmotivated and just easily confused. So if you break it down, you have 3 dimensions of sluggish cognitive tempo. You have the sluggish sleepy dimension, so you're going to seem more tired and lethargic. You have the low initiation dimension, where they just seem unmotivated. And then you have the daydreaming component where they just seem to just lose train of thought when you're talking to them. Sluggish cognitive tempo has been linked to more academic problems, problems with peer interactions, greater levels of depression, difficulties with problem solving, greater levels of withdrawal as well. So very, very important topic for us to take into account. We also need to be aware of the topic of alexithymia. This is a risk factor for criminality. This is a risk factor for suicide, the research says. This is a factor to take into account in substance use treatment. This is a deficit. It's been referred to as a personality trait, a multifaceted personality construct. It's been referred to as the client having no words for feelings. So the client who has this typically is going to have difficulty decoding emotional information in others. They're going to have a difficult time recognizing and identifying feelings in themselves and other people. This can be linked to more dysfunction and emotional unawareness, difficulty with perspective taking. They have deficits in interoceptive awareness. This is a big topic. There have been multiple studies that have looked at alexithymia within the context of risk-taking behaviors, violent offending. It's been studied within the context of substance use disorders, neurodevelopmental disorders, child maltreatment, empathy deficits, post-traumatic stress disorder, the list goes on. If you're working in clinical populations or drug and alcohol treatment programs, there's a good likelihood that half your clients or more probably have this. If you're working in forensic settings, elevated levels of this have been noted within forensic settings. This is another major topic for you to be aware of. We also want to be aware that in some cases, some clients will have a tendency to over-report their competencies. So when you are doing an interview, an assessment, an intake with people with extensive trauma histories, be on the lookout for this in some cases. You might want to fact check, verify, obviously review collateral sources of information when appropriate. Want to be aware of this because if this is not taken into account, this could result in the development of an ineffective goal plan, treatment plan, and intervention plan, just to name a few. So we spoke about shame before, but just be aware that shame is a toxic emotion. Shame can diminish your client's self-worth. They might be more likely to engage in negative self-talk. They have higher levels of helplessness, hopelessness, self-regulation issues. It can absolutely reduce their confidence and their social skill abilities. Shame, we need to be aware of self-blame, self-criticism. This could contribute to that client struggling with being assertive. It could also contribute to having more adjustment problems, and in some cases, it could increase the risk of victimization and vulnerability for some individuals. And unfortunately, too, for some people with high levels of shame, this could contribute to greater levels of self-regulation problems as well. These are just a few studies of many that we need to take into account when looking at this again through that COVID lens. I just want to remind everyone, consider everything I'm talking about through the era of COVID-19 and beyond. How did COVID-19 impact your clients? How are they impacted by the lockdowns? Are they still dealing with a fear, worry, uncertainty of the future with COVID? So these are just very important things we'd want to take into account. So we're just going to take a quick break. When we come back, everyone, we're going to jump deeper into criminal justice forensic implications. We'll see in just a few minutes. Well, welcome back, everyone, from the break. So we're going to take a deeper dive now into trauma through that criminal justice lens. Hopefully that first half gave you a really good foundation about a number of different topics and subtopics to consider when working with trauma survivors. So trauma can come in many shapes, sizes, and forms. So when we look at trauma through a criminal justice lens, a lot of things to consider. Animal abuse could be a type of trauma. Maybe you're working with someone that lost an animal during a domestic violence situation. Institutional abuse. Maybe someone experienced kidnapping, arson, carjackings, exposure to child pornography, cyber victimization, stalking, human trafficking, identity theft, having a family member get murdered, suicide, workplace violence, sexual assault, sexual harassments. The list goes on and on and on. So just know that trauma can occur in many shapes, sizes, and forms. When we start looking at this through a criminal justice lens, and if we start infusing the adverse childhood experiences literature into this, be aware that higher levels of childhood trauma have been linked to having more externalizing behavioral problems. It's been studied within the context of juvenile offender population. So if you're working in the juvenile justice arena, there's an increased likelihood that that youth may have had higher numbers of traumas in their life. If any of you are working in offender reentry or criminal recidivism, there is a link between higher numbers of traumas and maybe an increased likelihood of recidivism. Some of the reasons for that is that maybe they didn't develop good coping skills. Maybe they struggle with maintaining employment. When we start looking at this through a confinement setting, unfortunately, we know that if you're working with folks within confinement settings, higher levels of mental health issues, substance use, rejection by family, having just greater difficulty in life because of many barriers and limitations. So we really want to take this into account when working with anyone involved in the criminal justice system. That can be with survivors of crime, perpetrators, and both. This is just a good visual of some of the studies that I was referring to just in the last slide. So you can see it. There's numerous studies that talk about the adverse childhood experiences within the context of various forms of antisocial behavior. By no means is this an all-encompassing list. There's more and more studies coming out on this all the time, but basically what I think I can say with close to certainty, and this has been my experience, the greater involvement someone has in the criminal justice system, repeat offenders, high-risk offenders, people that have committed homicide, domestic violence, there's probably a greater likelihood that they've had some trauma earlier on in life. So delinquency has been studied within this context. There's a multitude of factors that have been linked to greater levels of delinquency. We need to consider, again, prenatal trauma, postnatal trauma. We need to consider, were there any developmental abnormalities early on in life, birth-related complications, things of that nature. Looking at the school environment, what was going on in school, educational dropouts, learning challenges, peer rejection, exposure to community violence, exposure to violence within the home. What is that youth's involvement with their peers like? Are they in a gang? Are they around peers who have a tendency to engage in problematic behavior? What was the modeling like that they're exposed to growing up with caregivers? Did they lack moral guidance growing up where the caregiver was engaging in criminal behavior and that child just observed that and thought that was normal? We need to be aware of socioeconomic factors, frontal lobe impairment, head trauma, attachment issues. These are all factors that can contribute to increases in delinquency, and all of these are found in the literature. I have lower future orientation underlined here. Just be aware in some cases, the individual may not ever plan for the future. They're always living in the here and now. This is definitely indicative of more impulse control problems, self-regulation deficits. But other things we want to consider when we're looking at this through a delinquency lens, an antisocial lens, early histories of hyperactivity issues, problems with poor verbal or executive functioning capabilities, severe untreated mental health issues, co-occurring substance use issues. What's the home environment like? We need to be aware, are there long-standing patterns of behavioral problems? We also need to be aware of histories of risk-taking behaviors. So a lot of these things may show up early on in life. So we want to be aware. Lots of red flags typically emerge. It just doesn't happen overnight. Parental incarceration, as we spoke about briefly before, this is a type of adverse childhood experience, but parental incarceration obviously breaks up that family system. It can absolutely disrupt the entire family system and contribute to more psychological strain. Kids that have had a parent incarcerated are more likely to have school problems. They might be more likely to deal with economic hardship. And for some of these kids, it could thrust them into the child welfare arena, unfortunately, in some cases. And if you look at the parental incarceration literature and its impact it has on the children and youth, the literature points to the fact that these kids typically are going to have more behavioral problems, more emotional problems, and depending on when the incarceration happened, it could have an adverse effect on developmental outcomes as well. So, for example, it could impact their socio and their emotional development capabilities. It could be a factor in contributing to more self-esteem issues, more confusion. So that's the impact it has on the child. If you're working with parents who are incarcerated, obviously we need to take into account re-entry in the community. So really looking at it through that trauma lens, looking at it through the attachment lens, taking into account the executive functioning capabilities. Really want to be aware of that. Foster care and the adverse childhood experiences literature. We need to be aware of this as well. There's actually a line of literature that talks about the foster care crime connection. It's really interesting research. But I want everyone to be aware that I'm not saying a child goes into foster care that sets them up to engage in criminal behavior. By no means am I saying that. It really has a lot to do with the placement they're in. Are they in a foster care environment where it's safe and stable? Or are they in a foster care environment where there's a lot of chaos and abuse and there's just countless kids in the home and not a lot of oversight? It really depends on a lot of factors. If you look at some of the foster care literature, and kids who age out of foster care who were not adopted, who did not have a structure in place, they were bouncing around from placement to placement, they might be more likely to be exposed to various forms of trauma, neglect, and sexual assaults, unfortunately. As they age out of the foster care system, so they become adults, they might be more likely to experience homelessness, financial issues. They might be more likely not to have completed school that can trickle down into having more employment problems, more mental health issues, and a greater reliance on public assistance. This is all talked about in this literature. Now, how does this link to violent behavior? By no means am I saying someone that's experienced tons of trauma in childhood is going to become a violent offender when they get older. But if you look at the histories of people who do engage in violent offending, they're more likely to have these trauma histories. Part of the reason is the trauma early on in life may have impacted the brain, which then is linked to their impulse control, their emotional regulation. Part of the prefrontal cortex is not working, and then they might be more likely to engage in these behaviors. The reasons for violent behavior, again, like all of these things, are many and varied. For some people, it could be the result of revenge. Could it be fantasy driven? Could it be the result of mental health issues, drug problems? Is it the result of a loss of relationship? Could it be the result of road rage or self-defense or even out of survival? Could it be part of a gang culture or jealousy or loss of employment? All of these things need to be considered. The consequences for violence can increase anxiety, job loss. It could result in that person losing their children in some cases. It could be a factor in divorce, greater levels of broken bone histories. It could have a huge impact on just their financial status. All of these things definitely we need to take into account. If you work in sex offender treatment, learning about this topic is very, very important. The reason why I say that is because the research does point to the fact that sex offender population, especially juvenile sex offenders, may have a higher incident of adverse childhood experiences compared to the general population. So if you study the adverse childhood experiences literature, be aware that perpetrators of sexual abuse are going to be more likely to struggle with intimacy deficits. They might have problems with empathy, the use of empathy, understanding empathy. They could lack perspective taking, so we want to be aware of theory of mind deficits. Insecure attachment problems have been noted to be much more common, more issues in the area of social cognition, more executive functioning impairments, more issues with loneliness, just to name a few. It's really all over the map. When you're working with one sex offender, they have different unique experiences than others, but that's kind of what the literature says in general. There's a lot packed into this slide here. Let's look at distorted cognitive schema, just in case you're not familiar with that topic. This is a type of distorted thinking pattern where it's an unhelpful thinking style where the person really has a tendency to perceive reality incorrectly. They might have more all or nothing thinking. It could come off as very black and white thinking or very, very rigid kinds of thinking. They might have a tendency to catastrophize more, overgeneralize. They might place more blame on themselves or other people, and they have a tendency to discount the positives. Going a little bit deeper into attachment, if you look at the disorganized attachment literature, this is typically the result of growing up in a home with an unpredictable caregiver or an abusive caregiver or an inconsistent caregiver. It could be the result of being thrusted into the child welfare system. It could be the result of prenatal trauma. They might have more anxious or avoidant styles. They might feel more uneasy in certain situations. This can contribute to more intimacy deficits, trust issues, and they might feel really uncomfortable with being emotionally close to other people. So it can really be all over the map. And then I have poor boundaries underlined here. Extensive trauma can sometimes impact boundaries that client may have. Part of the reason for that is they might have more attachment problems. They might have more boundary issues in terms of they don't understand give and take relationships. They have those empathy deficits maybe or perspective taking. They might engage in age inappropriate behavior. So maybe you're working with a 16-year-old client chronologically, but maybe they have a brain of a 10-year-old. They might get confused about like social boundaries. So teaching social skills, friendship making skills, decision making skills, these are all going to be very, very important. So a lot packed on that slide, but a lot of things to take into account. When we talk about trauma too, let's be aware of complex and developmental trauma as well. If you study complex and developmental trauma, the majority of the perpetrators of this kind of trauma are going to be the caregivers of the child. Complex developmental trauma is going to be more prolonged. It's going to be more cumulative. It can absolutely contribute to all of those things I spoke about before when we talked about the adverse childhood experience literature. Complex developmental trauma literature has talked about In some cases, it can contribute to more judgment problems in the individual. It's been linked to more impaired coping skills, self-injurious behaviors, the engagement of risky sexual behaviors as the individual gets older. The person might really lack a sense of self, so they just don't know who they are. They might have a tendency to be more gullible, more naive in some cases. Want to be aware of the diagnostic criteria for complex PTSD. This is found in the ICD-11. This is not found in the DSM-5. So just be aware of that diagnostic criteria. Without a doubt, again, like all kinds of traumas, this can contribute to more self-regulation deficits. So studying this within the context of complex trauma, it's equally important to consider the impact this has on self-regulation, self-control deficits as well. When you work with incarcerated youth, it's not just the trauma we need to be aware of. There are some studies that point to the fact too, consider that youth sensory processing abilities. If you work with someone that has sensory processing problems, this could contribute to more unexplained behaviors. It could be a factor that negatively impacts their mood regulation state. It's been shown to have a negative impact on adaptive functioning capabilities. For some people with sensory processing issues, they might have more over-responsive or under-responsive behaviors. They might only wear certain kinds of clothes. They could refuse to eat certain kinds of foods. They might be more sensitive to light or certain smells. They could be very sensitive to touch. They could lack body awareness, so they might walk too close to someone. They don't understand body awareness. They might bump into things more frequently. They could have a hard time riding a bicycle, bouncing a basketball, catching a baseball, going up and down a ladder, using a hammer, those kind of things as well. So this might be another professional to work with, is like a sensory processing specialist. If you look at the literature on trauma within forensic settings, this kind of sums it up. The majority of the people you work with who are incarcerated will probably have a history of trauma of some capacity. Some research points to the fact that female offender populations might actually have higher levels of earlier traumas than males. The reason for that is partially related to domestic violence exposure early on in life. So we want to be aware of that as well. So if you're working with females who are incarcerated, take into account trauma histories, head injury histories, mental health, addiction histories, histories of poverty, homelessness, and even sleep-related problems. And that can be the same for juvenile populations and male populations as well. The very nature of being incarcerated for a long period of time could be a trauma in and of itself. So we need to be aware that some clients who were arrested and convicted and went to prison have not only experienced trauma before they went to prison, but then in prison were they exposed to a lot of trauma as well. So we need to be aware of that variable as well. So we got to take that into account. Several studies have talked about incarceration populations within the context of COVID-19. So we need to be aware of this topic as well. We know that COVID-19 related feelings increase levels of uncertainty, feeling disconnected, higher levels of irritability, anxiety, depression, and sleep problems, to name a few. It might have been even more severe with incarcerated populations because COVID definitely ran rampant through some confinement settings in the United States and around the world. So we need to be aware of how that impacted the individual while incarcerated. So as we get into interviewing and screening considerations, we're going to look at this through that trauma lens again, and we'll continue to infuse neurocriminology, forensics, neurocounseling literature into all the things we're talking about. So any professionals working in really the helping professions, there's a strong argument to be made to become trauma informed. If you are a trauma informed evaluator, interviewer, clinician, whatever kind of work you do, taking into account when you're doing the interview or the information gathering session with a client, does that client feel safe? Do they know how to communicate effectively? Understanding that some clients with these extensive traumas may have more anger control issues. They might be dealing with more hyper or hypoarousal issues during the interview. They could come off as having higher levels of like feelings of hopelessness and helplessness. They could become really easily overwhelmed during the interview. They might present with more fatigue and more depression as well. So we really need to take this into account during the interviewing process. If you were doing any kind of forensic interviewing or forensic evaluation work as well, just really being aware of this topic among the people you assess. But this can be applied to anyone. This can be applied to an attorney, a school teacher, a medical doctor. If you're working with clients during that interviewing process who have extensive trauma, trauma reactions can be triggered by a variety of things. Trauma reactions could be all over the map. It could be the client has more anger problems. They could shut down and become more silent during the interview. They could run out of the interview. They could cry during the interview. They could be in shock. They could laugh at inappropriate times. They could fall asleep at times that just don't make sense. They may have very unusual or bizarre behaviors. It really could be all over the map. So really considering the role and impact trauma has during the interview is going to be very important. So if any of you want to become like a trauma-informed interviewer, just again, being aware that trauma survivors may have more memory problems. So taking that into account, there could be some gaps in their memory. They could come off as being more confused during the interview. So take that into account. Don't jump to conclusions that the client is doing this intentionally. They could have a trauma trigger. We just don't know. High levels of trauma could contribute to that interviewee feeling more tired. They might need more frequent breaks. They might have a very difficult time staying focused. For some of these folks, they may come into the interview being really alert for the first multiple minutes and then all of a sudden just shut down and seem like they just are a completely different person. Trauma can rob people of their joy, their energy, their motivation. They might have uncontrollable reactions again, crying one minute, laughing the next, shutting down the next, storming out the next. So really be aware that again, that trauma can impact people very differently depending on a host of factors and circumstances. Anytime you're doing an interview, doesn't matter what field you're in, be aware of this topic of suggestibility, because if suggestibility is introduced into the interviewing equation, this can call into question the validity and the reliability of the information you're obtaining from the interviewee. And some studies have found that clients that have more trauma in their background may be more suggestible. So really taking this into account. You have interrogative suggestibility, you have interviewer suggestibility. Be aware of Gisli Johnson's work in this area. I'd highly recommend looking at his work. Look at Elizabeth Loftus' work, Misinformation Effect. Be aware of the topic of compliance, confabulation, a lot of things to take into account. Trauma-informed interviewers are going to take these things into account. So just be aware, a lot of these are common sense, but trauma-informed interviewers in the criminal justice, forensic mental health arena would want to maybe consider utilizing kind of these approaches. Empathy, being aware of body language, vocal tone, facial expressions. For some clients with extensive trauma histories, they may have a tendency to misread social cues. They may be more triggered by vocal tone. So just considering that during the interview. Just another reminder too, through an empathetic gesture lens, through that trauma-informed interviewing lens, just some common sense things, but a good reminder for us to be aware of. We also want to be aware of the topic of the window of tolerance. For some clients with these extensive trauma histories, if they get out of that window of tolerance, it could contribute to hypoarousal issues. They shut down, or again, they could become very hyperaroused and become very erratic and have a hard time staying regulated. So being aware of the window of tolerance is another big topic I would recommend. So just to remember, a recap on a little bit on trauma-informed interviewing. So these are just a few things to take into account. I think it's important to fact check, verify, try to become trauma-informed, doing things that don't re-traumatize the individual. Be aware of memory contamination. So you want to be aware of suggestibility, compliance, confabulation, gullibility, naivete, and even the topic of credulity. I'd look that up too. That's a really interesting topic to be aware of. The hypoarousal symptoms, again, this could just look like the client is really shutting down. For some people that haven't had training in this, hypoarousal in some interviewees could look like that client is being evasive and non-cooperative, when in fact, maybe it's a direct result of a trauma trigger. So when clients do this, take a step back, stay curious, dig deeper. Could there be something else going on? For some of these clients too, they may disassociate. So extensive trauma histories are linked to more disassociation. So interviewees who disassociate, they may have more prolonged blank staring. So you ask a question to them and they kind of might be like deers in the headlights. They could lose track of the conversation. So maybe they're answering questions that you asked a minute ago. They're just not staying on topic. So these are just some things to be aware. They could lose track of time, a lot of things to consider. So I've been really thinking about trauma-informed interviewing. I'm actually writing an article on this. I'm putting together a specialized training just on the topic. And this is just my own opinions. If you want to move in the direction of becoming a trauma-informed interviewer, these are some things I would really just ask yourself and consider. Is your organization doing this? Are you doing this? This is not an all-encompassing list, but these are just some important reminders. So let's just briefly go through this. So in my opinion, becoming a trauma-informed interviewer, you're starting to learn to recognize the signs and symptoms of trauma and know that it can vary. We're learning about the neuroscience and the biological aspects of trauma. We're going to do everything in our power as interviewers not to re-traumatize the individual. We want to be aware of rapport building, empathy, those kind of things we just spoke about before. Engaging in empathetic listening, being patient, kind, calm, curious. We want to be aware we're not jumping to conclusions, so no preconceived notions. We'll be very careful on how we craft the questions. Some clients may struggle with understanding complex questions, so making sure we're developing questions that are understandable. They're not leading, so we want to be aware of that. Is the environment you're interviewing the person in safe? Ensuring safety, staying current on the literature, consulting with experts, attending trainings like this. These are just some of the things I would recommend if you want to start moving in that direction. So trauma-informed care is more of a systems approach. We're taking into account policies, procedures, practices. We really want to be aware of, is the environment safe for the client, but also this is equally important for staff. We really want to be aware that if it's a trauma-informed organization, staff typically feel more heard, more known, more valued. If staff feel like there's a problem, they can feel safe to come to their supervisor and share how they feel. There's more of a team environment. There's more cohesion. There's more of a sense of taking care of one another. We're focusing on health. We're focusing on burnout prevention. We're focusing on not overloading staff with all kinds of tasks where they feel like they have to bring their work home with them and work into the wee hours of the night and work the weekends. We're promoting self-care, very important. If you're a clinician, trauma-informed treatments, there are many of them. When we start utilizing trauma-informed treatments, trauma-informed interventions, we're really focusing on, again, establishing safety for the clients, but also you're really focusing on positive relationship building. You're focusing on helping that client make sense of their trauma and helping them develop more of a coherent life narrative, being aware of like post-traumatic growth, meaning making, focusing on self-reflective abilities. We're focusing on strengths, promoting resilience. We're helping them identify trauma triggers. We're enhancing relaxation skills, focusing on enhancing sleep practices, helping that client learn how to express emotions and feel safe about it. There's a lot of therapies that are talked about in this literature: cognitive behavioral therapy, trauma focused CBT, play therapy, mindfulness based therapies, animal based therapies, expressive writing. There's numerous therapies out there that talk about like trauma informed interventions. Some other ones you want to be aware of: attachment and biobehavioral catch up, attachment, self regulation, and competency, child parent psychotherapy, parent child interaction therapy, trauma systems therapy, trust based relational interventions, eye movement desensitization reprocessing, EMDR. The list goes on. We could spend all day talking about all these. Those are just a few of the ones you'll find in the literature. So in the era of COVID-19 and beyond, it also talks about the importance of really infusing trauma-informed care practices into the work you're doing, especially within that organizational context, because some organizations were absolutely impacted severely by COVID. The medical community, first responders, those are just a few, even people working in factories. Being aware of different kinds of protective factors against stress, because again, toxic stress exposure can wreak havoc on the brain, on the body. It's been linked to more depression, more anxiety, more inflammation, more insomnia, more asthma. It's been linked to more obesity, more headaches. It can impact gastrointestinal problems. It can accelerate the aging process. So really want to be aware of different kinds of treatments and protective factors. Some treatments for this, like with the trauma ones, mindfulness-based strategies, breathing techniques can be helpful, biofeedback, progressive muscle relaxation, parenting classes can be helpful, face-to-face interventions, telehealth interventions, problem-solving therapy, maybe it's peer support. The list goes on and on and on. Screen for stressors. What's going on at the individual level for the person? What's going on at the family and social level, and then what's going on in their community? Psychological distress can come out as depression, anxiety. For some people, it can come out as panic attacks, psychotic symptoms. It can present as post-traumatic stress symptoms, and it can present as suicidal thinking and behavior as well. So very important to understand what's going on at the individual, family, and community level, to name a few. Just a good visual again that chronic and toxic stress can wreak havoc on all domains of functioning. But look at this. When we're looking at this through an anger control lens, be aware that it can amplify negative emotionality. It can decrease our coping ability, so we might be more likely to deal with emotional dysregulation. Remember some of those coping distortions we spoke about before, like all or nothing thinking, catastrophizing. Chronic stress has actually been linked with more cognitive distortions. It can decrease inhibition. This is our internal parking brake that falls under the umbrella of executive function. And it's been shown to amplify impulse control issues. So these are all things to consider when we're looking at it through that criminality lens, to name a few. We covered prenatal trauma before. But again, take a look at this. Prenatal trauma and early childhood toxic stress exposure has been linked to children maybe developing higher levels of PTSD, anxiety, depression, presenting with more anger control issues, more oppositional behavior, more attachment problems, more impulse control issues. It could be a factor in that child as they get older having more disassociated symptoms, and it can contribute to greater levels of fear, hopelessness, and helplessness, just to name a few. Visually here, just take a look at this through kind of that neurological lens. Children who experience tons of toxic stress and it goes untreated, it could absolutely impact these. I would say this is the umbrella term for most of these things. Executive function, CEO of the brain. Some of these kids could look like they have ADHD. It can impact planning. They might be more impulsive. They might have a harder time managing their mood state. It can get in the way of making appropriate decisions. Working memory falls in the umbrella of executive function. This is our brain's post-it note. So this can get in the way of problem solving, multitasking. People might not be able to hold a lot of information in their memory. It can also impact social and behavioral considerations, and it can impact the way in which that person communicates with those around them. Just some questions to consider, in my opinion, through kind of a trauma and attachment informed lens. If you work with clients that have had these histories, if you work in an organization and your staff experience these are all very important things to consider and to target and to really start infusing trauma-informed interventions into the work you do, because any one of these things here can erode that client or staff's ability to reach their full potential. So remember the internalizing symptoms before. These are just things you'd want to screen for, be aware of. These are inwardly experienced, so these are going to be a little more difficult for you to detect on face value, but these are very important. So these can relate to higher levels of depression, feeling more unwanted, maybe feeling more defective. It can contribute to anxiety, so we want to be aware. Screen for level of anxiety, triggers. Maybe there's a history of obsessive compulsive disorder. Does the person also meet diagnostic criteria for post-traumatic stress disorder? Do they deal with some level of social anxiety? Could this contribute to increases in irritability or concentration issues? You bet it can. Sleep issues. It can impact gastrointestinal functioning. So screen for anxiety. Screen for depression. It could contribute to lack of energy. Does that person have those feelings of worthlessness, or are they carrying around a lot of guilt? It can impact their decision making. Depression can impact weight gain or weight loss. It can have a profound impact on attention and memory. It can really impact all facets of life. Screening for their coping strategies. If they're engaging in problematic coping strategies, these are just a few things to consider. Do they turn to tobacco products to cope with stress? Maybe it's emotional-based eating. Or are they spending compulsively or drinking excessive amounts of caffeine? Or maybe under high levels of stress, they have a tendency to run away or have elopement behaviors, or they thrust themselves into the internet. These are all problematic coping strategies that you would want to probably be aware of, screen for, and target with intervention. For some clients too, they may struggle with more self-defeating behaviors. So maybe they have a fear of being alone. This can absolutely contribute to more self-doubt, more self-esteem issues. It can contribute to higher levels of problem-solving deficits, and it can get in the way of goal planning as well. So if you have clients that struggle with this, they might really have a difficult time achieving their intervention or treatment goals as well. So we talked about the harsh parenting practices before. So just again, this is just something to be aware of if you're working with families maybe involved in the criminal justice system, child protection, those kind of things. But again, just really being aware of patterns of harsh parenting practices. Other things you'd want to be aware of is executive functioning impairments. Again, we talked about this. This is just a few of my observations I've noticed over the years in terms of cases I've consulted on. By no means is this an all-encompassing list. It can differ from person to person, but these are some of the consistent patterns that I've noticed over the years. These might be potential red flag indicators to be aware of. And maybe if you notice clients with these behavioral patterns, referring to like a cognitive specialist, a neuropsychologist for some more testing might be warranted. So remember, we talked about goal-directed behaviors before. So if your client really struggles in any of these areas, it can get in the way of that client achieving their goals effectively. These are just some of the steps involved in order to achieve long-term success. Staying persistent, thinking creatively, thinking strategically, our ability to set realistic goals, our ability to stay focused and resist distractions. These are just a few targeted areas that you'd want to consider if any of you do any kind of goal planning or intervention planning with your clients. Other things you want to consider, because some of these things are direct threats to your client's emotional and social and physical well-being. But being aware of their smoking habits, very, very important to take into account. Excessive smoking consumption is linked to more mental health problems. It's talked about within the criminality literature. I'm actually doing a talk coming up on excessive caffeine consumption through energy drinks. There's actually a couple studies that have looked at this through a criminality lens. Excessive sugar consumption has also been talked about within the context of criminality. Being aware of their technology and screen time habits. Excessive weight gain, weight loss, drinking habits, ruling out sleep disordered breathing, daytime fatigue, pain issues. These are just some things you'd want to consider. Sleep, again, remember we talked about sleep. These are just very important variables you'd want to consider when working with clients who have sleep issues. And remember, from the sleep literature, there's several studies now that have talked about sleep within the context of the criminal justice system. Some studies say that chronic sleep deprivation may be a factor in criminal behavior in some cases. If you look at some of the false confession literature or suggestibility literature, some studies have shown that chronic sleep deprivation could be a factor in some cases of false confessions and suggestibility. So ruling out sleep, the reasons for sleep issues are many and varied, but just really be aware that most likely if you're working with people with extensive trauma histories, they're probably dealing with some level of sleep issues, or maybe they're on medications or over-the-counter meds for sleep as well. So this is one study of many that talks about just excessive sugar consumption. Lots and lots of studies have talked about this, but what this study found is that people who were experiencing high levels of chronic stress were more likely to consume sugar. I've experienced that in my life. When I'm under a lot of stress, I'm craving more sugar products, very normal, but just be aware that this can contribute to blood sugar dysregulation. And if you truly want to understand some of this stuff at a deeper level, look at some of the literature on blood sugar dysregulation, glucose metabolism deficiencies, insulin issues. Fascinating literature that talks about how blood sugar dysregulation could be a factor in some cases of criminality. It's been studied within the context of a lot of different topics. So excessive sugar consumption, high levels of stress, these are just a few factors that could impact blood sugar regulation. Dehydration can drive up blood sugar issues, chronic sleep deprivation, disruptions in routine, skipping meals, living a sedentary lifestyle. These are just a few factors that have been shown to impact blood sugar regulation. Screen for verbal ability. If your client struggles with communicating with other people or sharing their thoughts, this can really get in the way of the intake, the assessment, the intervention. Does your client struggle to use words to convey meanings to other people? This can get in the way of active listening. This can absolutely contribute to more frustration in the individual, because if that person struggles to communicate verbally with other people, they may become more dysregulated and frustrated, and that can spill over into potential rage control issues for some individuals. Screening for reasoning skills too, for some clients, depending on their level of cognitive dysfunction, they might be struggling with more reasoning deficits. And if you work with clients who struggle with reasoning, this can get in the way of creative thinking. This can absolutely get in the way of learning and interpersonal functioning. Even negotiating with other people is really influenced by reasoning skills. This can contribute to more catastrophizing, and the client may have a really hard time reading like social situations, those kind of things. So being aware of how reasoning skill deficits could be a potential huge barrier for some of your clients. So as we move into interventions, I've sprinkled a lot of interventions throughout today's talk, but I'll give you several more to think about. I'm a big fan of utilizing strengths-based approaches. I think we can't go wrong with learning about like positive psychology, focusing on strengths-based approaches. Trauma-informed care is really a strengths-based approach, but this, when you use strengths-based approaches, it's really a collaborative process. You're focusing on the client's strengths, their abilities, their potentials. You're capitalizing on the client's strengths and their interest, and you're focusing on their positive attributes. Now, it's very important, obviously, to understand the client's limitations and barriers, but it's equally important to understand their strengths and their abilities. If we can use strengths-based approaches, that has been linked to increasing positive self-esteem for your clients. It can help your client increase their self-efficacy. We're really teaching clients to be more patient, more optimistic, and more persistent, to name a few. Maybe you're focusing on their academic strengths. Maybe there's some family strengths at play. Focusing on positive identity development. We're capitalizing on health and wellness. We're promoting grit. We're promoting resourcefulness. These are all things linked, and they really fall under the umbrella of those strengths-based approaches. We want to be aware that when we are, again, working with people who have experienced extensive toxic stress, complex developmental trauma, adverse childhood experiences, it's really imperative, in my opinion, to utilize a trauma-informed care approach. But I'll tack one thing on here that I haven't talked about today. I think it's important when you're using trauma-informed care approaches to also utilize integrative behavioral health approaches. So if you start infusing like integrative behavioral health approaches into trauma-informed care approaches, you're focusing on collaborative care, whole person care. It's a holistic mind-body approach. You're focusing on the biopsychosocial aspects of that client's health. You're focusing on psychoeducation. We're patient-centered, we're team-based, and we're recovery-orientated, just to name a few. So these are just a few things you would want to consider, again, with a trauma-informed care approach. And part of this is focusing on empowerment and self-empowerment, helping that client make more intentional decisions about their own future, helping guide that client into more hopeful thinking, making more positive choices. You're focusing on helping that client become more self-confident. You're focusing on really promoting positive self-esteem dynamics, and also really focusing on just helping that client improve their overall thinking, because a lot of forensic clients may be dealing with more negative thinking patterns. So really identifying that and helping them really become more hopeful, more optimistic. You're focusing on self-efficacy. These are all things that can be very helpful and really help that client thrive. Within this literature, again, lots of things to take into account, because again, when you're working with clients, let's just say in the juvenile justice system, incarcerated youth are more likely to have disrupted family patterns, more problems in the area of the educational realm. A lot of times they might be dealing with more social skill impairments, higher levels of resilience, or really lower levels of resilience, and higher levels of loneliness and depression. They might have a feeling or perceived feeling of abandonment, especially if they were like thrust in the child welfare system. They never met their birth parents. They might feel powerless, fear. So it's imperative to infuse trauma-informed care principles into this work, because it has been linked to helping these individuals reduce reoffending rates. If you study offender reentry, criminal recidivism, you've probably come across the topic of trauma responsive reentry interventions. Very similar to trauma-informed care, but it's really focusing on this specifically with a reentry population. So again, we really want to be aware of the impact trauma has on the client's brain, on their body. We really want to be aware of the neuroscience aspects of trauma. It's so important to start really understanding the neurological components of trauma, especially the central nervous system, the autonomic nervous system, the HPA axis we talked about a little bit. This research also talks about neuroplasticity literature. It does talk about helping the client restore a sense of self-determination, autonomy, and safety. It's also focused on teaching the client improved self-regulation skills. You're teaching the client greater levels of empathy. You're focusing on hope and positive growth and enhancing well-being and emotional regulation strategies and psychoeducational approaches, just to name a few. So with post-traumatic growth, if you're not familiar with this particular term, think of it as positive psychological change that that client experiences after the traumatic event that happened to them. So really focusing on enhancing personal strengths. You're helping that client really tap in to their abilities and their talents, and you're focusing on helping that client really regain a sense of self, increasing their confidence, helping them look to the future as bright rather than bleak. You're focusing on increased self-awareness. There's a couple screening tools you'll find in the literature related to post-traumatic growth. One is called the Post-Traumatic Growth Inventory, and another one is called the Stress-Related Growth Scale. This is another positive psychological health asset. So anytime we can infuse this kind of literature into the work we're doing, hopefully it's going to trickle down into helping that client improve their overall mental health, but also have a really positive impact on their physical health. So hopefully they'll sleep better, they'll feel better. And if you peel back the layers of the post-traumatic growth literature, it also talks about the importance of understanding resilience, being more planful. It does talk about religion and spirituality in some cases, learning how to seek emotional support and not being afraid of asking for help, and helping the client gain more instrumental supports as well. And under the umbrella of post-traumatic growth and positive psychological changes, you're going to find literature that talks about benefit finding, positive adjustment, stress-related growth. There's a lot of terms you'll find out there, but those are just some of the ones you'd want to consider. Within the forensic arena too, we're really focusing on recovery, depending on what recovery model you look at. Again, you're focusing on empowerment, self-acceptance as well for some things can be helpful. So helping the client move from a state of denial or repression to accepting, that can help create some change. You're helping that client maybe overcome some barriers, obstacles, and stigma. Teaching that client how to take control over their own life. So again, that goes to kind of the heart of having better self-control, better self-monitoring abilities, greater levels of self-awareness, helping that client maybe build a strong support network, or even re-establishing or healing broken relationships they've had in the past, helping that client develop a sense of purpose and connectiveness, and really infusing hope and optimism into the work you're doing. I think part of this too, when you focus on like recovery orientated approaches, focusing on promoting choice making can be very helpful. Utilizing motivational interviewing, utilizing those strengths-based approaches, and utilizing trauma-informed care, just a few of the things that can be helpful. So trauma-informed orientated approaches, these are just a few things you'd want to consider. So it'd be a collaborative working alliance. You're focusing on, again, self-management, helping that client become more self-aware of their triggers, helping them learn how to self-monitor more effectively. We're focusing on self-empowerment, and then we're really helping that client regain a sense of self, regain a sense of purpose, where then now they look to the future as hopeful and positive, and that can help hopefully improve their motivation as well. Other intervention techniques you might want to consider when you're working with offender-based populations. Again, we've covered most of these, but these are just a few. If you can teach clients how to learn how to self-monitor more effectively, they're going to hopefully be in a better position to make more informed decisions. They're going to understand their triggers. They're going to be able to connect the dots more between their actions now and how that may impact them or someone else tomorrow. Remember the discussions we've had about the critical components of goal planning, intervention. When you establish a goal plan, a treatment plan, or an intervention plan, it's imperative to look through that executive function lens. Self-control training, you're basically teaching the client how to put on the brakes, pause, reflect, think through their actions, and teaching them that it's okay not to react every time you have a feeling. Sit with that feeling. Be curious about the feeling. Just slow down, learning how to delay gratification. Some of these clients may be dealing with, again, some communication, language, social skill impairment. They may struggle to work in a group, or they struggle one-on-one. Focusing on interpersonal skill development can be very helpful. This might be done in a group. This could be done one-on-one. Some of these clients may really struggle with substance use issues, so helping them, again, stay sober. Lifestyle modifications, this could be the way they eat, their sleep patterns, learning how to lose weight, getting better exercise. These are just some lifestyle modifications that you might want to consider. So trauma treatment, again, a lot of things to consider when we're working with youth, children, or adults. So to recap, when you're looking at it through a trauma lens, anything you can do to make sure the environment feels safe. Safety, I think, is like foundation. And again, this can also apply to your work environment. If you are working in an environment and your staff do not feel safe, you can about imagine the outcome that can have for the whole organization. It can contribute to burnout, it can contribute to trust issues, the list goes on and on. Focusing on self-regulation. If we can learn how to self-regulate, that's a really critical component of trauma interventions. Focusing on relational engagement, enhancing attachment patterns, and really focusing on how that client displays their emotions to others as well. These are just a few things you'd want to consider. If you want to look at this through a developmental treatment approach lens, again, we've covered all of these, but I just underlined a number of different things you'd want to consider. Just some things for all of you to be aware of when you're looking at this through that trauma developmental lens. When we're talking trauma, again, we really want to be aware of attachment. So focusing on enhancing attachment patterns, utilizing attachment-based approaches, infusing that into the work you're doing, oftentimes can result in better outcomes. There's actually a whole line of literature too on attachment-based leadership approaches. So if we have any leaders or organizational managers listening to this, you might want to check some of that literature out as well. Now, we talked about the adverse childhood experiences literature, but also being aware of the positive childhood experiences literature. Again, a lot of this is common sense, but really focusing on improving that sense of belonging for the client, focusing on relationship enhancement, improving the family system, helping that client have a sense of belonging or connectedness with a larger group. So maybe the person would do well becoming involved in some sort of club or hobby activity. Something like that can be very, very helpful as well. So positive childhood experiences have been linked to increases in healthy social development. It can help offset some of the exposure someone has already had to trauma early in life. And it's also been linked to improvement in overall wellness. So definitely be aware of this literature. So early on, I introduced all of you to the topic of neurocounseling. In the neurocounseling literature, it does talk about the adverse childhood experiences. So if you're a counselor, a therapist, a rehab specialist, a skills worker, if you work with anybody in a coaching, teaching, modeling capacity, learning about some of the basics with neurocounseling can be very, very helpful. So you're infusing, again, neuroscience research into the work you're doing. So we talked about prenatal stuff today, prenatal trauma, but I really want y'all to be aware of the first 1,000 days of life research. This is day 1 of conception all the way up to the age of 2. This is very common sense literature, but it's a very good reminder of the first 1,000 days of life is extremely critical for brain and body development. So this first 1,000 days of life is the time to target early intervention and prevention. And again, trying to have the pregnancy free from drugs, alcohol, toxins, tobacco, getting good sleep, eating healthy, staying in contact with healthcare providers. Obviously easier said than done, depending on the clientele you're working with. There's a lot of barriers, but really being aware of this literature, I think, can help us better appreciate the prenatal years and the early childhood years and how it can influence people throughout the entire lifespan. Coping, again, we're talking lots of strategies, interventions, coping approaches. So positive coping strategies, we're going to be more active, we're going to be more planful, we're going to know how to use humor effectively. We'll tap into our emotional supports more effectively. Negative coping strategies, denial, substance misuse, smoking, excessive sugar consumption, self-blame, high levels of shame. So really looking at how your client uses their coping strategies can be very, very helpful. So again, we talked a lot about like positive psychological assets today, life purpose, self-esteem dynamics, finding stable housing, promoting healthy family communication, enhancing financial stability. These are all positive psychological health assets. Promoting resilience in the people we work with. There's so much literature on resilience. There's resilience within the criminal justice literature as well. But resilience is a protective factor. Think of it as a psychological strength. Higher levels of resilience are linked to really a greater ability for our clients to manage stress, to recover from illness, to just feel better, to think better. It's been linked to improvements in confidence and problem solving, and it can help people improve frustration tolerance, to name a few. A lot of things we can do to help people improve resilience: get better sleep, exercise, laugh more, take up a hobby, learn about optimism, gratitude. All of these things can be very, very helpful in improving resilience. So optimism, think of it as having more of a successful mindset. We're helping clients develop more hope about the future. It's a strengths-based approach. It's been linked to more self-efficacy, improved creativity, improved confidence, and improved emotional and physical health, to name a few. Promoting gratitude is very, very important as well. That's been shown to help increase happiness. It's been shown to promote emotional regulation. It's been shown that it can help reduce anxiety, depression, stress, to name a few. Understanding grit as well, hanging in there when things get tough, even though you want to throw in the towel. This is a sign of like perseverance, endurance, helping clients just really stick with it, even though it may be tough right now. Just knowing that if you push through it, great things can happen. Promote self-regulation. I've talked about that several times now, but if you're working with clients with some of these factors we talked about, there's a very good chance that they're probably dealing with some level of self-regulation issues. Screening and targeting avoidant coping strategies. So your clients have a tendency to deny, minimize, procrastinate, ruminate. These are important target areas to be aware of. Talked about alexithymia briefly before, but just be aware this is an important target area for interventions. Several interventions have been talked about in this literature. Mindfulness-based strategies, DBT has been talked about in this literature. Just getting better sleep, learning how to name, label, process emotions. Psychoeducation approaches have been shown to be helpful as well. I'm a big fan of scaffolding interventions as well, maybe utilizing some of that and incorporating that into the good work you're doing. Anytime we can promote internal locus of control, that's been linked to greater levels of self-efficacy, higher levels of self-esteem, improved motivation. It can help people engage in more reflective thinking. People with external locus of control typically have more problems. So focusing on enhancing internal locus of control can be helpful. Expressive writing, journaling, these have been shown to be a very effective self-care strategy. Group drumming is something you'll find in this literature, really interesting. So you can go online and find some different programs out there, a lot of good research on group drumming. Teaching clients how to use humor effectively, process it, make sense of it. Using humor effectively is a great way to reduce stress. Working with an exercise specialist, developing an exercise plan, getting movement. Several studies show the benefits of exercise, and some studies have shown that it can actually help reduce criminal behavior. Yoga has been studied within the context of prisons, and it's been shown to be helpful. Yoga interventions can be extremely helpful. Many benefits of yoga. I'm a huge fan of the self-compassion literature, so just be aware of teaching clients how to be more kind to themselves and understanding. And it's really self-directed warmth and empathy and having sympathy for ourselves. Greater levels of self-compassion have been linked with increases in resilience and self-confidence. This has been shown to be a positive psychological health asset. Teaching breathing techniques can be very, very helpful. getting clients outside in nature more, being around green space, blue space can have a profound impact on their mental health. And some studies too have shown that green space exposure may actually reduce some people's likelihood of engaging in aggression and violent behavior. So remember, allostatic load, we spoke about that before. Meditation may be one way of reducing allostatic load and wear and tear on our body. Teaching parents how to use mindfulness and incorporating that into parenting, that has been linked to having better parenting outcomes. The parents typically listen more, they're more attuned, they're more compassionate to their child, they have greater emotional awareness, and it can promote greater levels of self-regulation as well. Volunteering, getting clients to volunteer if appropriate, has been linked to not only positive cognitive benefits, but take a look at this study. Volunteering has actually been shown to reduce inflammation in the body. This goes back to the psychoneuroimmunology literature I spoke about in the beginning. Animal interventions can be extremely helpful. Music, art therapy, all of these other kinds of therapies have been studied within the context of criminal behavior. Art for trauma treatment, art for expressing our emotions can be so helpful. And just be aware too, the importance of maybe consulting with a nutritionist, a dietitian, a functional medicine specialist. Eating healthy has been talked about in the trauma literature, and it could be one intervention of many to try. And anything we can do to promote positive brain health, which could be rooted in like having more self-compassion, promoting resilience, laughing more, promoting more joy, promoting a mindset of curiosity, helping people learn more, and anything we can do to increase exercise and eat healthier and reduce inflammation and form positive social support groups, reducing screen time exposure. These are all things linked to positive brain and body health. So that is it for today, everyone. I know we covered a lot of information in the past 3 hours. If you have any questions about any of the information covered today, please reach out and I'll be more than happy to get back to you. Thank you again, everyone.